The word spectrum is present because of two reasons. Number one, these children don't necessarily look exactly the same. Some may have stereotypy. It means they would either shake their hands like this or rub their hands like this. Some may be able to talk, some may not be able to speak even simple words by the time they are a couple of years old. Because of that, it's called spectrum. The other reason why it is called a spectrum is because of the underlying genetics. These diseases are not caused by just one gene, they're caused by thousands of genes. And if any one of them goes haywire, you end up with a disease, what we call autism spectrum disorder today. So since 1980s, a lot of people have tried to understand whether autism really has a genetic basis or not. And in fact, there is a genetic basis to autism for sure. In one of the largest studies, and the very first one that was done in India, and it was co-led by myself, we ended up showing that in nearly 1 out of every 3 cases that walks into the clinic presenting with autism, there is a genetic cause. There are thousands of genes that are involved in the development of the brain. Now, what we have identified is that there are a couple of genes that are what do you call the usual suspects. The most common one is Fragile X or fratraxin gene, which is generally mutated in the males only. The second one, which is very common, is MECP2. Now, it's generally girls who are presented with mutation in this gene and not boys. It's lethal for boys. Beyond that, there are hundreds to thousands of genes, any one of which is mutated would lead to autism spectrum disorder. So the largest study that was done to date, we ended up showing that in children where a genetic diagnosis was made, in 70% of the cases, it was because the mutation was only present in the child. That mutation wasn't inherited from either of the parents. What that simply means is, it's also, by the way, called as de novo mutation in medical literature. It means that when either the sperm or the egg was being formed, the DNA that was in there somehow got mutated, and that mutation is now only present in the child. The parents don't have it. So if, for example, a parent is planning for another pregnancy down the line and their first child had a de novo mutation, the risk of their second child having a similar mutation remains less than 2%. What it means for the child is that now that they have a clear-cut genetic diagnosis, there are 2 or 3 critical benefits that comes to them. For example, if a child is diagnosed with a de novo mutation in MECP2 gene, which is involved in Rett syndrome, there is a treatment available for them, what is called as trofinetide, right? So it helps in identifying whether the child could get a reasonable treatment that is available as of now. The second one is for the parents, whether when they plan for the second pregnancy, would that child have a similar disease or a similar gene getting mutated or not. And the third one is that when this child grows up and plans his or her family future ahead, the same genetic test result would help them planning for the reproductive life ahead. So if a child has a de novo mutation and when it's their chance to have a reproductive life, then the risk of their child inheriting this mutation increases to 50%. In the remaining 50% of the cases, the child would be completely normal. If it's a scenario whereby a child has inherited both faulty copies of the DNA from both of the parents and his or her partner are completely healthy, then the risk of their child having autism drops down to 2%. So we went from understanding why autism occurs, what are the genetic basis for it. Now is the time to think about treatments. And this is where the world is moving into, to try and understand how these mutations impact the structure of the brain and how we can design treatments to ensure that despite these issues in the brain structure development or synaptic development, how can we remodel them in a way that this child can have a happy, healthy future.